Folks, we hope to be joined by Senator Orrin Hatch in this segment, but let me just tell you that the senator, along with Senators Richard Burr of North Carolina and, as we mentioned, Tom Coburn of Oklahoma, have released a legislative blueprint that analysts say could help the Republican Party offer that much talked about alternative to Obamacare. And let me tell you what they have come up with. Obama's Patient Protection and Affordable Care Act has extended, health care to I don't know how many people have signed up, whatever you want to call it. But the Republican alternative is called the Patient Choice, Affordability, Responsibility, and Empowerment Act, or CARE Act. And it would repeal Obamacare's mandates, the taxes, the fees, the mandates, and replace the law with what aides called common sense. Oh, I love hearing that. Common sense, patient-centered reform that are intended to lower costs. As Ed Rollins just told us, it's sticker shock when you go on the Obamacare website and look for an Obamacare policy, not only in the premiums, but the deductibles. Well, joining us now is Senator Orrin Hatch. Senator, welcome back, sir.
Well, happy to be with you guys. I think you do a terrific job.
Thank you. Appreciate that. And I'm so glad that you and the other two senators, Senator Burr and Senator Coburn, have come up with the CARE Act. Talk a little bit about what's in it and how it would differ from, I know it would repeal the mandates and the taxes and the fees, but what would it provide for?
Well, I'm really pleased that both Richard Burr and Tom Coburn, two really fine senators, have joined with me to unveil our vision for the alternative to Obamacare. Basically, our plan rests on four simple principles. Three of us knew there was another way, a better way than Obamacare, a way that doesn't need 2,700 pages of government programs and mandates to enact common sense reforms that the American people want or need. So these two senators I've joined with on this proposal have been looking at this for some time, and I want to commend them first. But the four simple principles that we built this bill around are: first, repeal Obamacare with all its costly mandates, taxes, and regulations in its entirety. Get rid of it. Second, reduce costs by taking the government out of the equation, and instead empowering consumers to make choices about their own health care. Thirdly, we provide common sense consumer protections to protect individuals with pre-existing conditions. And fourthly, we think you have to reform our broken Medicaid system by giving states more flexibility to provide the best coverage for their citizens. Now we're confident that the plan that we've come forth with would accomplish all of that, and I think it would do so without adding one red cent to our $17 trillion debt. And those four principles are the core of what we unveiled yesterday. They're smart, they make sense, and they are what people of my state and Utah and elsewhere, I think, have been looking for. So, to start with, the biggest barrier to health care in this country are skyrocketing costs. Most people are having trouble affording to buy insurance or even see a doctor. And why? Because of the high costs.
Right, and Senator, when you go, like I said, as you joined us, when you go on the Obamacare website, from the stories I've heard, it's not only the premiums, but people, there was a segment of the population that they're expecting to buy this insurance that never heard of deductibles. And when they and everyone else sees the deductibles in these plans, there's no way they could afford that.
Well, they're all high deductibles. Our plan would give people affordable options, that meet their needs we would harness the power of the marketplace, not through Washington-directed mandates. We basically would allow the states to manage these, this approach. And we would give more options in the private insurance marketplace, particularly in the small group and individual markets. On top of greater consumer protections and more transparency, people would be better able to purchase the coverage that's right for them. So we can see the importance of choice in the failings of Obamacare. Obamacare is struggling to sign up young people who might just need a health plan that's affordable instead of one that includes coverage they'll never use, and one where they're cherry-picked to pay for, more senior people with more problems.
So could we talk about, Senator? We're talking to Senator Orrin Hatch here on the Steve Malzberg Show, and one of the co-authors of this proposal, Senator Tom Coburn, revealed today that through Obamacare or under Obamacare. He has lost his oncologist. He's, of course, unfortunately been diagnosed with cancer, and his coverage has been greatly cut. Yet, I mean, he's in a position where he's able to work around that. He's a doctor, the whole thing. But I mean, this horror story, I really feel, I almost wish that he was giving the rebuttal tonight to Obama in the State of the Union, so he could tell his story to the American public, because this is a story that he needs to tell, because there are probably hundreds of thousands like him and millions who are losing their coverage, and don't have cancer.
Well, take a 25-year-old male auto mechanic, for example. He just wants catastrophic coverage because he's probably not going to be sick for quite a while. He doesn't want a plan that includes maternity care. I mean, come on.
I know. I'm going to get that.
Well, we need to give people those options to allow them to find the coverage that best meets their needs, and this bill does. We provide significant common sense consumer protections, like making sure that a person can't have their coverage canceled if they get sick. We also help make patients with pre-existing conditions, we give them the right to gain access to affordable coverage and let children stay on their parents' insurance through age 26.
Good. So it addresses the key handful of points that the Democrats always tout as being liked by the public. So that's a very good thing, a very positive thing.
Well, that's right, and we basically have always been willing to keep kids on the family policy to age 26, and also help people with pre-existing conditions. I mean, those are Republican ideas, and they just grabbed them and acted like they're the only ones that have them. We would give the states more options to provide people with more coverage, while once again reducing costs, under our plan. And I want to pay tribute to Tom Coburn as well as Richard Burr. They're both great conservatives up here, and Coburn's been one of the all-time best, and Burr is certainly there. But what we came up with, families earning up to $71,000 or 300% of the federal poverty level, they'll get a tax credit to help purchase the insurance of their choosing. By the way, the president's program goes to 400% of poverty or $91,000 a year.
Yeah, crazy.
I mean, that's more than most people make. The average wage in this country is a little less than $50,000 a year.
Senator, I want to ask you, before I let you go, about the State of the Union tonight. What kind of tone are you expecting from the president when he delivers his address?
Well, he's always very charming. He's a good speaker, but I think he's going to be very partisan, and I think he's going to expect the Democrats to be jumping up and down out of their seats like a bunch of robots, and frankly, they do. and we have to do it too. If he says something that we agree with, I mean, I get a little tired of that. I think we ought to be a little more staid in these meetings and let the president tell his story and let it go from there. But I suspect it's going to be a pretty partisan speech, and at least that's what the media seems to tell us it's going to be.
And can he cloud the waters, do you think, or muddy the waters from now to the election in November with this income inequality and minimum wage, or is it going to come down to Obamacare and the disaster that has wrought? Well,
do you want to know the truth? He wants a year of action. That's going to be his big pitch. But I think we ought to pass bipartisan reforms to create jobs and grow the economy. We should approve the job-creating Keystone XL pipeline. That's 20,000 big-time, high-paying jobs, and as much as over 100,000 derivative jobs in the future. We ought to reduce the costly medical device tax that's running costs up. We ought to approve the Trade Promotion Authority so that we can get the 11 nations over in Asia and the 28 nations in Europe to be free traders with us, which we would do. They're willing to do it. We just can't get the administration to move. And 5 years into the Obama economy, I think it's time to make it easier and cheaper to create jobs and expand opportunity.
Would be nice. It certainly would be. Senator, thank you.
Could I just mention one other thing?
Yeah, we got 30 seconds, though. Go ahead.
Think about this. We've had 5 years of Democratic policies. They haven't worked. Income inequality is up. That's a laugher if he thinks he's going to talk about that.
Right.
Opportunity for economic success is down. Income inequality is the highest since before the Great Depression. Nearly 4 million people are unemployed for 6+ months, and median household income is down by nearly $4,000 under
Absolutely.
Obama. And he's talking about inequality. The best thing we could do for inequality is
Senator, thank you, sir. Senator Orrin Hatch, ladies and gentlemen.
The Steve Malzberg Show.